Good morning, Dr. Lydia Troth here. It's been a while since we've had an update, so I thought I should give you a little update. It's been quiet here, which is really, really nice. It's nice to take a little break from COVID and be able to just be able to see patients, which is wonderful. Now, we have seen some increased cases of flu. So if you are sick with fever, body aches, cough, definitely consider that it could be flu. Our swabs are checking for both flu and COVID. We're using a COVID antigen and a flu test that goes together at the same time. We've seen a lot of upper respiratory things. Allergies are really, really high with the tree pollen like it is, leaving yellow everywhere. You can imagine that a lot of people have some increased allergies. And yeah, we're still seeing a few COVID cases here and there. Definitely not as much as we were seeing in January, but we are still seeing them. So let's have a little COVID update, and let me give you an update on where we are. Last week, the World Health Organization met, so they are over the entire world, kind of looking at the spectrum of where we are as a world when it comes to COVID and other disease processes. And they said, yes, y'all, we're still in a pandemic. There are still a lot of countries still struggling with COVID and having some definitive case surges. So you say, okay, well, where are those? Shanghai, China is in full lockdown. They had an exponential increase in cases, so they are pretty high right now. Canada is seeing some increase in cases. The United Kingdom has been having increase in cases, and now their number of deaths are higher with this current wave than what it was with the previous Omicron wave. And then here in the U.S., Washington, Northeast is seeing cases. So Washington, D.C., Pennsylvania, New York, Rhode Island, Delaware, and New Hampshire are all seeing increases in cases. Now, what they're saying for the Northeast is that they expect that hospitalizations will peak in about 3 weeks. And so if you look at the little map, they're yellow and red there. And so they're saying, okay, you need to be putting on your masks, because what we're trying to prevent is overwhelming the hospitals, so that, because you know what happens when we overwhelm hospitals is we have so many cases of COVID there that people who need other care can't get that care. And so if you go in the hospital with a heart attack, your care might get delayed because they're trying to take care of someone in the ICU with a COVID case and they don't have a bed for you. And we don't want that to happen. And we would like to try and prevent that if all possible. So, Northeast, they're saying, okay, time to put your mask back on. What does that mean for us? Good question. Usually we lag them by a couple of weeks. They're seeing an increased surge of cases now. There's a possibility in the next 2 to 4 weeks, we're going to see an increased case surge. And that's a possibility. I can't definitively predict that. You have to consider there's a lot of different factors there. What we can say, or what the good news is that, 50% of the U.S. had Omicron during the last surge. So maybe, just maybe, it might mean that we're going to see less of a surge here in the United States, and particularly here in the South, where we did have a lot of people with COVID. So maybe if you had COVID in January, then that will give you a little extra immunity against this next surge. Hard to say, because we're already over 3 months out. And so it may mean that your immunity is gone. We don't know. And we'll kind of have to see as we approach it. Right now here in Conway County, our mask level is yellow. So we're in this isolated little pocket with Pulaski County and Conway County and Faulkner County and just central Arkansas, where our case levels dropped for a little bit, but then they started going back up again. And so when you look at the big map, there's just this yellow spot, and it's central Arkansas. So I'm not really sure what that is or why that happens, or because we do seem to have plenty of hospitals here. So, and some of it's determined based on the availability of hospital care. But that means if you're high risk right now, I'd probably keep your mask on. We also have a 4th booster right now. So if you are over the age of 50 and it's been 4 months since your last shot, then it's time to get your 4th shot. And so that will help protect you. And what they did is they went back and they looked at the studies and they said, okay, we know that the people over 50 are a higher risk of hospitalization. So we would like to offer them a booster so that they can hopefully prevent that from happening. It's the same shot you got before. And if you haven't had your third shot, if you got Moderna, it's actually a half dose. So you're not getting quite as much. I know a lot of people had some issues where they felt pretty sick after getting their shot. And, you know, I heard more people complaining after Moderna. I don't know if the studies say that or not. I just heard that from people. And so what you, something to kind of take into account if you've been leery about getting your third shot because you felt so sick with your first two, is that if you got Moderna, you're only getting a half dose for the third shot. So it may mean that while you will hopefully still build antibodies, maybe you won't feel quite as sick if you were feeling sick. Okay, so that is where we are right now. Let us know if you have any questions. Of course, we're always here to do our best to try to take care of you. And if you feel sick, let us know. We will swab you if we need to, and hopefully help you get better soon. Okay, y'all have a great day, and I'll talk to you later.